on Bay Area psychology, we will learn about temporal mandibular disorders, often referred to as TMJ. TMJ is a problem with the jaw joint and its muscles. It affects up to 10 million Americans and yet often goes undiagnosed and untreated. TMJ can masquerade as other problems. The most common symptom is unexplained, persistent, and debilitating pain. The pain can manifest itself in many ways that seem unrelated to each other, such as neck aches, dizziness, or ringing in the ears. Unfortunately, sufferers can end up on a merry-go-round of doctors and treatment that do nothing to relieve the pain. This can ultimately lead to serious emotional consequences. Well, we are fortunate to be joined tonight by Dr. Howard May. He is a Bay Area dentist and with several specialties, one of which is TMJ. And I want to thank you for joining us tonight and
my pleasure,
making the
Mary.
time to come in and talk about this.
Thanks for having me.
We were sort of yakking before we began and talking about various aspects of this. But one of the things that struck me is this issue of so many people having this and not getting properly diagnosed and not being aware of it.
Exactly. TMJ can mimic a number of different situations. One of the most common ones is headache. People have headaches, undiagnosed, unexplained, typically in the region of the temples, and they just live with them and they take aspirin, but it's really a muscle ache that helps guide the lower jaw. So that's one of the reasons we end up seeing people. They get referred by neurologists who are treating them for headache, and it's not an internal problem. Another one is earache. That's one of the most common ones because the jaw joint and the ear canal are so close that many people who end up at their pediatrician or their general physician with an earache are told that to go see their dentist because they don't have a real earache.
So there's nothing going. You know, that one of the women I talked to, I mentioned before the show that it was a coincidence that everyone I talked to seemed to have TMJ. And she said one of the things that she noticed about this was if she plugged her ears, she could hear popping and clicking and actually hear sounds
right.
that she should not be hearing, I think.
Probably not.
Okay.
Some of those can be asymptomatic. You don't need to treat every pop or click in the joint. Some of those are just life experiences coming back to haunt us. But some of them can be more serious. But you did mention that many of these are undiagnosed. And it makes me think of a patient I saw recently who was a very successful stockbroker. And in a new patient exam, we do certain things. We manipulate the jaw to see how freely it moves. We check the muscles. We palpate the muscles of mastication, the muscles that help the jaw move. And in this person, I couldn't move his jaw. It was so tight. And when I palpated or touched his muscles, he yelped. He said it hurt. And so we had talked over a period of 6 months or so that he's got some TMJ symptoms that he might want to have treated in a conservative way. And I ended up making what we call a night guard, which is a piece of plastic that artificially repositions the jaw to a more comfortable position. And it literally changed his life. I mean, I saw his wife the other day for the first time as a new patient, and I asked how he was doing. She said, you know, he never told me he had all these problems. He's so happy now. I didn't know he had headaches for years. He never said anything. People live with these things.
That's what strikes me. Yeah, they just sort of put up with it and assume that it's getting older, maybe.
Right. You don't know what's normal, so you just say, okay, that's getting old.
Yeah. Wow. How about that? Now, we do have a graphic with some symptoms, but I wanted to call our attention to our little skull friend here.
Sure.
Maybe you can show us about how the jaw moves and when you do
out here.
Yes, when you do an examination.
Okay. This is the lower jaw, and the joint that we're looking at is primarily this joint here. It's the most complex joint in the body. It not only rotates like every other joint, but it can translocate. It actually can come forward.
Oh, look at that.
No other joint in the body does that. And that makes this joint far more complex than any other joint because the cartilage and the ligaments have to move with the joint. So that's one of the reasons that people do have problems with it. And it allows us not only to open, but to stick our jaw out, to eat bigger sandwiches, and to do a number of things we wouldn't be able to do otherwise.
Okay, so then what happens when something goes wrong is you can't open it, it looks like.
Exactly. Well, there are muscles now, muscles that insert here and go to the lower jaw, muscles that insert here at the temple and go to the head of this condyle of the joint that have to position the joint. So if the teeth are misaligned or you have an abscess and a tooth is high and you don't want to bite down on it, all these muscles have to get tense in order to bring the jaw together in a very specific way.
Oh, okay.
And that can lead to some of the symptoms of TMJ, like the headache that I was telling you about
Well, and
before.
I was noticing you said right up here in the temporal area was the muscles, so that makes sense.
One of the ways that if somebody's listening to this or watching today, and they think they have a headache and they're not sure if it's TMJ or not, they can simply put their fingers right where the temple is and squeeze their teeth together. And if they feel the headache bulging, if they feel the place where the headache is kind of getting tense and bulging, that's actually the muscle, and it's not a true headache.
Oh, okay. So then,
it's a little
instead of
diagnosis you can do.
Wow. So instead of running to the neurologist, we need to call our dentist. Okay.
Sometimes.
Yeah. Well, one of the reasons that, well, to look at the symptoms, but I know that one of the reasons I wanted to talk about this is there is also supposed to be a psychological component to TMJ. I mean, that either because of the pain or before the pain. And I'm wondering if you ever get people who you wind up having to refer to therapy in order to treat them.
Well, one of the reasons for diagnosing TMJ, acute TMJ, early on is that the number one psychological disorder associated with acute TMJ, that is less than 6 months duration, is anxiety.
Okay.
But if it continues more than 6 months, the major associated psychological disorder is actually depression.
Okay.
So this anxiety can turn into depression.
Okay.
So yes, sometimes what we need to do is counsel people to get biofeedback or actually to change their lives, because stress is a big component in leading to TMJ sometimes.
Well, and part of that is the kind of investigation of what exactly it is that's stressful for the person.
Right.
Let's take a look at some common symptoms. You've already mentioned a few, but we have a graphic with a list for us. Let's see, we have headaches, toothaches, burning, tingling sensations, earaches, neck aches or shoulder aches, tenderness and swelling, clicking or popping noises, or, as you mentioned, the inability to open the mouth freely. What is this burning and tingling sensation? Where would that be?
Actually, I'm not sure.
Okay, so that's not a normal one?
No, that's not one that I typically would see.
Okay.
I mean, the thing about TMJ is that there's such a huge variety of symptoms that can occur. Certainly, I've heard of burning and tingling. I have not seen it personally.
Okay.
I've seen a lot of other symptoms. I think one of the most interesting ones is ringing in the ears. I mean, you know, and dizziness. That's not an uncommon situation. So
yeah, and you wouldn't put that together with your, I mean, I wouldn't first think about my teeth. I mean,
no. Well, you know what's interesting? I think a lot of it comes from the fact that the body has such a significant protective reflex. And when I talk to patients about their TMJ and how they developed it and why their head hurts and not their joint, or why they've got pain in one place and not where they think it would be, I ask them to think about having a pebble in their shoe.
Oh.
Imagine if you had a pebble in your shoe that was so much sharp. Your body would not, your mind would not let you step down on that pebble. What you would do is rotate your ankle a little bit, and nobody could make you jump up and down hard on that foot with the pebble. And so what happens is your ankle starts to hurt after a while, your knee may hurt, your hips and your back if it goes on long enough, but your foot won't hurt because you won't purposely cause yourself pain. So you had a tooth that, say, was high because you had a high filling, or a crown that was put in improperly, it didn't match. You'd shift everything else to keep from closing down and hurting, causing yourself pain. And the body will accept some low-grade discomfort as opposed to acute, sharp pain. And that's really the mechanism that's working many times.
So we don't even know that that's going on. We just sort of compensate.
Exactly.
And then say, gee, why is this hurting? Well, that's what specialists are for. So you can point that out to us.
Right.
Let's take a look at our next graphic, which is causes of TMJ that might be more common than not. Let's see. Here's another multi-syllable word. Malocclusion of the teeth, psychological stress, bad postural habits, and trauma. So let's take a look first here at this malocclusion. Is that the grinding, or what is that?
Well, malocclusion it really means when the teeth come together badly.
Oh, okay.
So instead of the teeth coming together smoothly like this, maybe one hits and then slides. And in order for the jaw to slide and bring the teeth together comfortably, that joint has to come out of its socket and the muscles have to shift that jaw. And so malocclusion is a significant cause of pain in the jaw.
So they're not, if it doesn't shift, yeah, they're hitting each other.
Right.
Is that why you'd have some of the clicking?
Over a period of time, you will have clicking because there are actually changes that occur in the joint, remodeling of the joint. It's a very dynamic organ, and the bone will remodel, the joint itself, the cartilage will remodel, and you can develop bone spurs or soft places or thin places in the disc itself that cause these clicks. Now, the other major cause of a click is because of trauma.
Okay.
And it's because there are ligaments on either side of the disc, this cartilage, that moves to keep the two pieces of bone from hitting.
Mm-hmm.
And if one of these the ligaments is damaged, it will get doubled over. It gets elongated.
Okay.
And as you open, it squirts out of the way. And what you're hearing is this, it sounds like a click, but it's actually the ligament kind of popping out of the way. So it's kind of, it's pretty interesting.
That is interesting. And you would sort of get used to the popping, I guess. Well, we have popping in other joints. I'm thinking about, sometimes I'll get up and my knees will pop or something like that. Is it the same thing?
It very often is the same thing. I think it's important to say that not every person who has popping joints or or click should seek treatment. If you're comfortable, if you're asymptomatic, leave it alone.
Just something about you.
You might tell your dentist when you're there and have them evaluate it, but we don't want to over-treat asymptomatic situations. I mean, that's a very bad thing to do.
Yeah, yeah. That's what's the least intrusive thing possible, isn't it? Yeah.
Reversible, atraumatic, non-intrusive.
Good for you. I know that a lot of medical professionals don't necessarily ascribe to that kind of thinking, so good for you. What about this bad posture? Like, what kind of posture could we be talking about?
Well, the jaw position does change with posture. In fact, when you're laying back, if we're adjusting somebody's bite or if we're putting a crown in and we want to make sure that the crown fits the rest of their teeth perfectly, we not only check it when they're laying back, but we have to sit them up to check it because your posture causes your jaw position to change. So it's thought that people who may slouch a lot may protrude the jaw a little bit and cause stress in the joints.
Or people who sit forward, maybe?
Yeah.
Yeah, I thought in the book I read about TMJ, they had a picture of somebody who tended to walk leaning forward. Mm-hmm. So that might be an example of that.
Might be. I don't think it's one of the more common causes of TMJ, in my experience.
Well, yeah, it sounds like it would need to be fairly exaggerated to lead to that.
Yeah.
We're going to take a quick break. Stay with us. When we return, we'll learn more about spotting and treating TMJ. Welcome back. When we left, we were looking at possible posture and how posture leads to TMJ, but I wanted to get back to trauma. I mean, you had mentioned a little bit about that, but do you see people come in as a result of, what, car accidents or things like that?
Car accidents are a little less frequent. What I see is a lot of mothers come in from sitting their 3-year-old on their lap and having the 3-year-old raise their head very quickly and hit them in the jaw.
Oh, how about that?
That's one of the most common things we do see. And in this area, interesting enough, there's a lot of horses, people who raise horses, and horses tend to kick. And I've seen a number of people who have been kicked in the jaw. And that's a pretty serious injury.
Yeah.
So, now, the first injury we talked about from the child's head hitting you in the jaw, those tend to be transient. Those tend to be self-healing after a couple of weeks. Okay. But the horses are another matter. Yeah,
well, there's a lot of force, I'm sure.
Yeah.
Well, I'm wondering, too, if the symptoms could start young. We did a show recently looking at gang